I had gone to see my eye doctor because I had a little bit of problem with my eyes. She checked my peripheral vision and told me I'd lost the upper left quadrant in both eyes, and what I needed to do was go to the emergency room right now. When I walked in and told them that my eye doctor had sent me and what she thought, within 5 minutes I was in a CT scan, and 10 minutes later they confirmed that I had had a stroke and they were going to transport me to the main hospital.
Patients come into the hospital, they get taken care of by a lot of healthcare providers. They've got a lot of people talking at them, a lot of recommendations being thrown at them, but then we expect them to remember everything we've said, and they can't. That's just not reasonable. So HCA has come up with this great program where we get to take care of them once they've left the hospital.
I was called at least once a week for several weeks after I was released to make sure everything was going okay. I mean, it's just a lot of care that I haven't been familiar with in the past.
Rick's case is a patient with atrial fibrillation who had had a stroke. The current recommendation for him was to be long-term, lifelong, in fact, on a blood thinner. Rick came to us and said, well, I understand that I need this to prevent future strokes, but I also have to carry on doing I have to make a living. And my living is, I put up walls, I build homes. And I'm concerned about being on a blood thinner and having to continue to do my job.
That led to him being referred to a heart specialist that could put a device inside of his heart.
The Watchman is a device that's placed in this part of the heart to kind of seal it off from the rest of the heart so a clot can't form. But the advantage for someone like Rick is once you have the Watchman procedure, it reduces your risk of stroke without having to be on a blood thinner.
It's very important to me that the cardiologist would work with me on that, and that I would be allowed to make a decision in the direction that I want to go, because this is my life and my body, and I know how active I am, and I ride a motorcycle. I mean, there's a lot of things that went into the thought of the Watchman procedure. We did that procedure. I feel great. What's next for me is just to continue the work that I do. We're going to take a little ride this summer up to Yellowstone and on up into Idaho. So I'm looking forward to that. So life just goes on and everything's good.